All right. All right. Hello, everyone. I hope you can all hear us and see Dr. Chris Prue here. Uh, if yes, you can send us a message in the chat to say hi.
Just say hello anyway. Exactly.
Yeah.
And
Yeah.
remind me where you're from. Remind me where you're from. So what I'll do is I will. I'm trying to remember how many languages I speak. Oh, just one. So sorry, but
Yeah, maybe in a few months we'll use AI to auto translate everything we
yeah,
say
right.
for everyone, but we're not there
Exactly.
yet.
And give me a really cool voice too.
Yeah, yeah.
All right.
So we'll just wait for a few minutes to to let everyone join. I know that for some people, I mean, we have people registered from all around the world.
Yep.
So we'll wait for everyone to have time to join. I know that for some of them, they're coming back from work. Some of them are still at work. So yeah, so we'll wait a little bit. So
Yeah.
hi Jan, hi Marlies, hi Josephine, hi Kabalan. Nice, welcome everyone.
Awesome. Awesome.
Yeah, so I was saying we have people from a bit everywhere here. So South Africa,
Yes.
Norway, Lebanon.
Well, that's why this is my favorite one to do, because I then I can tell people I communicate, I speak with people from all over the world,
Yeah,
and it
true.
makes me seem important.
Yeah, of course. Yeah, yeah, I know. You're a ambassador,
Right? Exactly. 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 Oh.
All right. So let's wait for a few minutes. Hmm? Ah, oh,
Make sure I have settings share. Good. Yep, 2 more minutes.
all right. So yeah, very quickly for the ones who are not familiar, or who already have the system, or who knows about mainly maybe from digital. Hello, Kamen. So basically, BALISTON has taken over, let's say the digital, let's say, pro product that was previously sold by the digital company. So digital was a
Platform.
French, yeah. So digital was a French company, and BALISTON is a US based company, and we still have a team back in France. So BALISTON has different activities, but so all still in the connected footwear. So we work with shoe brands. We work with different type of partners to develop solutions to analyze how people move. For example, in golf, we have for running and different aspects. And also, so BALISTON acquired the medical product that some of you already know as Digital Pro, that is being rebranded to BALISTON Health. So you will see in a couple of weeks, I hope, this new update. So don't forget to update your app. And very quickly, I know that there are people from France as well. So for everyone here, but you've seen it in the communication. This webinar will be in English. It's recorded. Yeah, it's recorded. So you also have the session later. But if you have any question, don't hesitate. For French speaker, you can send messages in French. I will be able to reply directly to you. For English speaking people, we will be able to both answer. If there are people speaking Spanish, I can help as well. And then it will be the all the extent of our capabilities in terms of language. But if you're here today, then I think that French, English should be okay for you. But yeah, don't hesitate to ask questions. I will try to. So during this webinar, you can ask questions during the session in the chat. I will try to reply as much as I can. And Chris will at the end of the of his presentation, we'll have time for a full Q&A, unless Chris you want to proceed otherwise. But I think it will help. It will be good that way.
Yeah, absolutely.
So I think we're good to go. So if you have if there is any question, don't hesitate, and I let the floor to Chris.
Awesome. Thank you, Giannis. Oh, it's good to be back. I
Yeah.
know we take the summer off. We take the summer off, and um, people go on holiday. But anyway, thanks for joining us, and we look forward to interacting with you guys a lot a lot more as we move forward and we reconvene, utilizing the technology and as it grows. I did put my email over there in the chat, so if you have questions, you can ask in the chat. There's also a question area that you can ask questions. We'll look back and forth at both of those to make sure we try and get as many as we can. So, without further ado, I am going to, as I often do, I'm going to show some slides first, just to set the tone. Let's do that. And we'll have a little bit of matrix going on right here. All right. So what we do, so this is what we call a recurring webinar series. So gosh, we've been doing this every month for like 3 years. It actually started in French, and then we added this English version and did it. We took a break during the transition of the organizations, but so this is a reoccurring webinar series that is more so focused on our existing users. So those are people that have the equipment, and it's really designed to create some ways that people can look at it and maybe get a better understanding of how to review the analysis and maybe implement it. But certainly people that don't have it has been very helpful to a lot of people. So I don't go over, the details of the equipment itself and how to use it, but just do know that it is a sensor, an IMU, which stands for inertial motion unit, with accelerometers and gyroscope. And we put one in each neutral insole. So it's not a corrective insole, and it goes inside of a shoe. So we measure all of these analytics inside of a shoe. Now, to me, that's important because most of the people I'm working with are going to be wearing footwear. And so it gives me a sense of how they respond. I often ask them to bring whatever footwear they tend to wear, either at work or, in this case, we are actually going to be looking specifically at running. So a little bit less on the rehab, although there are going to be some implications in there because we can obviously use gait as part of the analytics if you're obviously dealing with an injury. And I wanted to show just a couple of things just to really bring or highlight some of the things that we do talk about with regards to runners and RRIs, or running related injuries. And just a quick sort of overview of what we see in the data. Now, I will tell you that absolutely we all have some of our own input when we're working with these people, simply because the data is not always out there. And like this is new, having the ability to be able to acquire these metrics in a lot of the environments now, instead of just doing it inside of a lab. So not having that and having something very portable like our system has really allowed us to gather a lot more data. So a couple things, changing speed. So there's some relationships, obviously cadence, stride length, and speed have this relationship, right? So speed, the velocity that someone's running is a product of cadence and stride length. And what we know about that, and that's often a metric that we talk about a lot, because if I slow someone down, their biomechanics can change, or if I speed someone up, their biomechanics can change, either good or bad, right? So if I see someone, not running appropriately and I slow them down, what we can do with that, and sometimes I'll use a treadmill. So you can do this on a treadmill, you can do this around a track, you can do this. One of the cases I'm going to show you was 5 kilometers out on a road. So you've got a lot of variability here. So there are some indications, some things that we have out there with regards to, are there predictors with regards to running related injuries? Can we predict, if we can look at, some running data, some biomechanics, can we potentially predict an injury? And we're getting better. And I think the technology is really allowing us to look at that. So there are some really good things. One is, looking at the history of that particular runner. Like I said, speed has some indication. Vertical ground reaction forces have some implication. That's challenging because, as I'll show you, simply just running faster increases vertical ground reaction forces, right? That's one of the things that we look at for a sprinter, and developing programs to train them, because we want them to push against the ground, very, very hard. But when it comes to distance running, we kind of want to soften that. So we want to minimize, that, and make sure that they're able to absorb that energy and not have it translate through the kinetic chain or even further up and causing some of these other problems. And then we can look at, running patterns, whether it's a midfoot striker, a heel striker, or a forefoot striker. And some of that might be related to speed or the environment in which they are. Some of it is related to the type of footwear that they have on while they're performing their runs. And some of it also goes historically as to really how they've been running, how they were taught to run, and just their overall technique, which again is something that we may want to consider changing depending on some of the characteristics that we might see. So that's that. And then there's asymmetry. Asymmetry has been under a lot of scrutiny, especially in sport performance. And absolutely, if you have a tennis player who is handed, right, they're a right-handed tennis player, you are going to see asymmetries. So when we're dealing with, looking at asymmetry, mostly what we're talking about is in that distance runner, for example, and more linear, where that asymmetry would be expected to be reduced or less, and high asymmetries may have some implication to performance. I will also say that even when we have high asymmetries in handed athletes, that it does actually impact their ability to move in a particular or linear direction. So as I mentioned, we've got technology today that really gives us some opportunities to collect more data. I talk a lot about walking. So when I have a runner, I always do a walking analysis on them first. And the reason is we have normative data in walking that we don't have in running, right? Because there's so many variables and so many differences in runners that we don't necessarily have the normative data that we can match it up against. And that's one of our limitations when it comes to creating some of these prediction models. So very individualized, right? But there's also some other performance characteristics. In other words, if you saw high asymmetry in ground contact time, whether it's absorption or in propulsion, do a jumping test and evaluate some of those characteristics, because that's something that we look at as far as the next step and decide whether or not that has some of that implications. In other words, like a strength profile, reactive strength profile, power output, and things like that. And so we do know that we can actually use some of these jumping tests to indicate some of these performances. So the evidence is that the highest predictors actually in previous injury. So if they've had an injury before, they are more likely to have another one. Dramatic changes in volume, increase in the intensity. Like I said, it just changes your biomechanics anyway. So if you don't have good biomechanics, which I'm going to show you one of those, then that could obviously be a potential predictor. The environment, if people are typically running. So we tend to see, more of these types of injuries in like cross-country runners around here that run through the woods, because they have a competition at a different place every single week. So my wife is a cross-country runner as well as coach, and so the terrain is very different. Strength of various muscles and range of motion in the joints. Rapid transition, when we look at foot ground contact time, and again, that's really new because we haven't really had that. And asymmetry, like I said, especially in linear runners. And there's some things that we can do to look at and tease some of these out as I say. And then, because I'm reminded that I need to talk about stride length. So stride length, we don't necessarily see as maybe the predictor of injury, but we do see it as a potential opportunity to make changes and make corrections. Like, in other words, if we just change stride length, you might see a dramatic change in some of these characteristics that might be associated with a running related injury. So this is the one I mentioned earlier. So this particular person is a runner, and they were training for a running event, and so this was a full 5 kilometers. So yes, we can collect a full 5 kilometers. You can collect a 10K, a 15K. You might go all the way up to a marathon if you have someone who can run a sub 2-hour marathon. That's not me. But so what we see here, and just to go over the dashboard real quick. So this is the dashboard that you see. So home is just going to show me my dashboard. Click on patients. It gives you a whole list of patients, all your patients, your equipment. So it shows me my pods and things like that. So I have 3 different accounts with various sensors and things like that. Settings. So you can set this in a different language. You can set this in metric. You can set this in imperial. And then depending on how your account is set up, so you can also even share some of these. So one of my accounts that we've shared, and we did a couple projects in other countries and things like that. So when I click on a patient, then it pulls up that particular one, and I just called this one a run. So there's a date and a time stamp to that. So this is just the general. So this is giving me sort of the overview of the information. So what it does is it aggregates all the data points and then gives us basically the means, right? But I'll show you in a moment that we can look at smaller portions or smaller sections of that. So give you a little bit of history. So this person went out from the clinic, and then they did a run. They brought their dog with them. And so now the system is designed to either collect data on walking or running as far as gait analytics goes. So there are firewalls set in there. And so one of the firewalls is it only will measure and collect that data if it knows that there's a flight time, right? In other words, there's no ground contact at some point between both feet. And that's actually what happened right here. She had to stop so the dog could go to the bathroom. So it doesn't collect or aggregate that data. So that's kind of good to know if you're going to send someone out and they start walking. So it won't start collecting until they start running, which is right here. They started running, and that data is not aggregated. So that's important to understand. So this is just a graphical representation of, we see up top here. So that's the cadence, and then the speed is down here below. Now we see these different data points, and you can put your cursor over that and you can see these different data points. These are, I believe it's 15-second aggregates. And so, it's not the full, and it's not one single moment in time per se. But it does give you a quick overview in a sense. So this particular environment was, a little bit hilly, and this is why it's representative. When I'll show you the next ones, a treadmill is gonna look just basically flat. Okay. So let's go ahead and look down. So we've got asymmetry. So we represent it as asymmetry because those numbers are potentially important. And we see that there's a plus 3%, and that's basically time. So that's going to be ground contact time in the swing phase. The strike pattern, and I forget why I didn't, but I did not get the strike force, but we get the strike pattern, which is actually the angle between the foot's orientation and the earth. And with that, it tells us whether or not they're a rear foot, a midfoot, or a forefoot striker. And it also gives you the strike force. And it uses a similar algorithm that's used with a force platform. Obviously, these are not force transducers, but we're using very similar characteristics or similar algorithm. And then the running profile. So it breaks it down. So we've got the left and then we've got the right. And we see the left, it gives you the total stride length and the stance phase and the swing phase. And then it gives us the double float, right? So that's going to be that flight phase. So we see 2.26 meters and 2.17 meters. So there's a little bit of a difference. And we see the stance phase is a little bit longer on that left leg. And I'm going to come back to that in a second because there's something interesting about that. Okay. And these pronation and supination angles. So this is a graphical representation. This is the mean or the average. And so this graphical representation is really good because you could put your cursor over that particular point. So this is landing. And so that's going to be what we refer to as maybe foot in or strike pattern. And so this is at negative 19 degrees. What that means is a negative orientation means inversion or a supinated foot position, right? Foot as almost like a block model. And so that means that they're landing on the lateral aspect of their foot, and then they get to transition. They're still slightly lateral, but what happens is they're approaching neutral position. And then we can see here it goes to -6. And that means that they're toeing off really close to that first and second ray, which is normal. That's what we want to see. Now, these thin white lines, those two are actually the variability measured in standard deviation. So it's not just a min and a max technically. It's actually a standard deviation. So this is a really good representation of what's considered to be normal. You'll also notice they're in green. So we use a color orientation as part of the artificial intelligence output to this. If it's green, it means that it's a normal value. If it's amber or yellow, it means that it's 1 standard deviation to 2 standard deviations outside of that normative value. And if it's red, it means it's more than 2 standard deviations outside of that normative value. So the good thing about the coloration is if I see green, I don't spend too much time on it, and it's fine. So we can actually look at the amount of time spent from landing into their transition phase, and then from transition into propulsion, and what that looked like as far as the orientation. Okay. So this gives you a quick overview of what it looked like between the 2 feet. So -19, -17. So heel striking was relatively similar. And then we see on this left foot that they remained a little bit more so on the lateral aspect of the foot than they did on the right foot. And that continues as we get into that propulsive phase. So what we can do now, let's say, with a 5-kilometer runner, some things I'm interested in is what did their pace look like at the beginning? What did their pace look like at kilometer 4? And what did it look like at kilometer 5, nearing the end of a race where they might do something like a kick where they increase their speed, as they're approaching the finish line or something like that. So we can go up here and we click on details. It brings up that same graph. And if I just click on one of those points, so this is, we'll call that's really within that first kilometer at time stamp 4 minutes and 15 seconds. So what we see here is we see an asymmetry plus 5%, not horrible. So we're looking at something you would probably start to see something in amber, or I should say, I like to start thinking about that once we get to about 6 or 7%. right? And then definitely when we get over 10%, that might be a little bit problematic, and we might want to consider that and investigate a little bit further. So then we look at the strike pattern. So she's definitely heel striking at -19 and -22. So that means in that more dorsiflexed position, and that's what that's representing. The stride length at 2.2 and 2.14. So we do see a slightly longer stride length on that right side than we do on the left side. Stance times also different, as well as the swing time. Double float is only at 5.3%. So again, we can look at these characteristics, and what we see consistently on that left side is a lot more in terms of that heel inversion or supinated foot position throughout the entire stance phase, right? And so it's fairly significant as far as an asymmetry goes between the two, at least in my opinion. What we can do now is that we can then pick and we can choose another time, and we can actually do a comparison, right? So as we're in 1430, we're just about approaching her. How far does she go? 21. So we're still in the 3rd kilometer. So, and again, at this moment in time, we're seeing again that asymmetry on that left foot, because we are now running from 11 to 12.9 kilometers. Let's think about that for a second. So if speed is the product of stride length and cadence, then we should see an increase in one or both of those, right? So we do see an increase in stride length, and we see that on both feet, which makes sense. So what you see here is these arrows, these orientations tell me that they increased, and we see that stance time actually decreased. That's also consistent with running faster. Your stance time, you're going to spend more time in the air than you are on the ground, right? So if you think about the ultimate, speed test, which is going to be sprinting, it's a very, very short time frame with regards to stance time, much longer swing time or air time, which will include swing time and the double float. So again, we see increases in that dramatic increase in the double float. So she's spending more time in the air. Okay. So we see that her angulation changed, and the reason you see the arrow in that direction is because it's being reduced. So it's negative, but it's getting and approaching closer to that zero position. Okay. But we do see some slight differences, and that's where you want to probably look at a couple different points. So let's look at something in her last kilometer. Oops. Let's go back. Let's choose that first one again, and then we'll choose something here in that last kilometer. So she's in the approaching the 5 kilometer mark. So she's nearing the end. So we do see that, there's an increase in speed just a little bit. Here's the cadence. And again, as we see an increase in speed, we often see an increase in cadence. So the attack angle is very similar between the two. I want to go back down to here. So we're still seeing, these differences between these angles, at least at the beginning. So you kind of want to look at a few different points, but I want to go back to and look at that average, and then I'm going to tell you the story here. And so overall, longer stride length on the left, shorter stride length on the right, but also a shorter percentage of stance time. And I want to come back to this guy right here. So we consistently see this -10, -6, -6, -3. So she's riding the more lateral aspect of that heel, and again with this right here. So if you've ever done this with someone that has what's referred to as a short leg, that's what you'll see, because basically her running pattern, she was on this crowned road. And so it's here in New Hampshire. And because we get rain and snow, it needs to be able to filter off. And so she explained to me that she was having some challenges, improving her running time, but she always ran against traffic. And so we drive on the right side of the road here. So she was on her left, which gave her a difference. So in other words, her landing on that left foot was going to be longer than it was on that right. And that's what I tried to explain to her, that eventually that could lead to some potential problems. Worst cases, we know that it was impacting her ability to run at a faster pace and really try to improve. So let's go to this next one, because I want to show you some comparisons. So the other thing that we can do if you have multiple tests for people, is you can click on what's called the evolution. And what this does is it will map out all of the tests that I've taken in a run, in a walk, or in a jump. Unfortunately, I disoriented these, so they're not in the correct order, but you'll get the point. So what it does is you can put your cursor and it will give you the highlights of each particular data collection. And it shows you that the pattern. Ideally, this would be, if I was, say, going through rehab or we were training for an event, we'd be looking for, improvements and whatnot. So this allows us to see all of that really quickly, because it puts all of these metrics right here in front of us, like all of these metrics. Okay. And so I'll show you the impact force here in a second, but so this is an interesting way to be able to look at all of the information of a particular individual and their pattern. If I click on the practitioner analysis, it brings me and gives me all of those tests. So what I want to do is I'm going to start with this slower one here. Okay. Same thing again. It gives you the information up top in terms of a date and timestamp. We see the speed, we see the cadence. So the cadence is low. Now, the reason for that is if you have people that run and are relatively trained runners, they're probably a little bit more efficient. So they probably have a longer stride than a normal person, and they can capitalize on that, and they don't need as many steps, right? Their cadence can be lower to basically get to the same speed. So we show really no asymmetry here. The strike pattern on the left, right? So the left foot, we see that they are slightly dorsiflexed, and so they are midfoot striking. And this is again at this particular speed. And then we see, but on the right foot, they're actually midfoot striking. Pretty close in stride length, but again, it's short, especially for this person's height, because they're about 1.8 meters tall. So they have a 1.5 meter stride length on the left and a 1.4 on the right. But I just want you to remember that, because we're seeing a longer stride on the left and a shorter stride on the right. So let's look at the foot characteristics in ground contact. So a couple things to note here. You'll notice these lines are very, very tight. Okay. So that typically means that, they're not overly stressing. They're pretty capable of performing at this particular pace. So it's really not problematic. But let's look a little closer, and we see that even at that speed, we see a couple of things. One is we see the landing at negative 7.4 on the left, and almost double on the right. And let's see where that takes us. I'd rather see this on the right than I would see this on the left. But anyway, let's go up a little bit further. So we see the transition. At least it's following the appropriate pattern, right? This is classic. So the one that I had shown you before is very consistent, and that's a pretty normal and standard pattern with the trajectory of this graph. Okay. Well, we see a little bit interesting, not a great deviation, but we actually see a little bit going in the opposite direction. But again, at this speed, really not a big deal, and it's not that much different. So this was at a relatively slow pace. So this was at 7 kilometers an hour. Let me check my time here because I want to see if I can go through. Let's go just a little bit faster. Okay. And this is about 20% faster, but it's still slow, right? So we're only at 8.1 kilometers an hour. Still, symmetry is really pretty good. And we do start to see a rear foot strike pattern on that right foot, but pretty consistent. The strike force at 2.4 kilonewtons is consistent between the right and the left. Now, a lot of people will ask me, well, what's ideal? It depends, because if this person, weighs 110 kilometers, 110 kilograms, versus someone who only weighs 80 kilograms, they're automatically going to have a higher strike force. And so it's going to be somewhat relative. I mean, again, you could tease out some of that in body mass, thought processes of, what is the ideal, what is their body fat percentage, and here's what's happening as a result of that. So we see, again, pretty close with regards to stride length, still greater on the left side by, 1/10 of a meter, right? So nothing too dramatic by any means, 10 centimeters. Let's look at the foot orientation. And it actually looks a little bit better, in fact. We see a slight width. So we do want to see a little bit of variability, because that tells me that they're able to actually correct themselves as they're going through their patterns, whatever it may be. Obviously, this is going to be in ground contact. So we typically don't see zero variability. Okay. So that tells us that if you're familiar with like heart rate variability, right, you know how we want some variability, because that tells us that the system is capable of varying and responding to changes in environment, for example. But we still see a 20 millisecond difference between the landing into the transition phase. So we see that they're spending a lot more time from transition into propulsion. Who knows what that means? I guess we'll have to keep looking at that. But we see at least a fairly normal pattern between the two as far as the trajectory goes. And what I mean by that is from foot in. So if you are going to be a heel striker, you're going to heel strike with a slightly inverted calcaneus, and then you're going to move through that pattern of reducing that into a more neutral position, not total. And then it gets even more neutral. And again, this is a foot model inside of a shoe. So we're not looking at midfoot. We're not looking at calcaneus alone. We're looking at it as a solid block orientation. So again, this is at 8.1 kilometers an hour. So let's go a little bit faster. And we're going to go up to, this should be what, 10.9 kilometers an hour. Okay. We do see, again, it's only 3%, so that's not that big of a deal. I'm not overly concerned. The strike pattern is very similar. There's a slightly higher strike force, 2.4 up to 2.7 and 2.6, but again, not dramatic. And it's also something I would expect to see. But here's something where we start to see some changes. And again, maybe it's not a big deal, but we start to see now there's a longer stride length on the right than there is on the left. And so that's at least something to note compared to those slower speeds. And then we start to see this. So this is their foot orientation, right? Now, this is somewhat normal. Okay. Again, I'd like to see -12, -15, but their angle is not great. So they're almost midfoot striking. So there's not a lot of work to do from landing into transition. But this is not right. So we don't want to see this, because now they're landing on the lateral aspect. So calcaneal inversion and supination. And they're reducing it a little bit into almost foot flat position. But then they roll back out instead of trying to toe off from that first and second ray, right? So they're really going to that outside. and that's at the 10.9, almost 11 kilometers per hour. And then we'll go to the fastest one. So this is like a pace that this person can potentially run at comfortably, but we start to see a much greater asymmetry. So this is where, again, like I said, I start to think about and start looking at that. The rear foot heel strike on that left foot, pretty similar. The right foot seems to be increasing a little bit, but as you'll notice, that's partly due to the increase in, the stride length as well. And again, we're seeing this continuous growth of the stride length on the right versus that left pattern. And let's go ahead and do a matchup here. And now we see a couple things. So we see these numbers are still going in the wrong direction. So we don't really want to see that. We start to see an increase in variability. So they're a little bit too much. So they're approaching, and that's why you see that in amber, right? So we're looking at about a 4-degree standard deviation. So that's becoming a little bit problematic. And that really kind of tells us that they just don't seem stable. And it's really almost throughout. So we're seeing almost 3 to 4 degrees throughout the entire stance phase. And again, definitely, wider than what we're seeing here, which is a pretty normal foot orientation um, on that left side. So we didn't go any faster, but again, this would say to me, we've got something going on here now. Actually, they do. So their problem is they've got laxity in the cuboid. So they've got a little bit of cuboidal calcaneal laxity. We suspect maybe that ligament might actually be missing due to some previous injuries, but also just very poor strength on propulsion in comparison to the other side. Very, very tight, especially in the peroneal muscles, and so and inactive, right? So you would think that it would help that, but we've got some other orientations of things that are not working really well. So this person actually does have a problem, and we can obviously correct things like strength and tightness, but if there's an abnormality in the cuboid, the cuneiforms relative to the talus and the calcaneus, being able to go through transition, we might actually need to post them and give them something of a more permanent solution, which is going to be the some type of orthotic. Oops, let me find there we go. All right. Whew, I did it. I got a minute to spare too.
Great job, Chris. Thank you.
we like it when I can get it in within time. So let's open it up. I mean, if anyone has any questions, and again, if writing in English is challenging, certainly you can send it to my email, which I posted here in the chat.
Yeah.
Chris@baliston.com, and I'll figure out a way to get it translated between all the folks.
Yeah, no worries. We can manage. Yeah, so please go ahead, ask some questions if there are some, I don't know, even use case or things that you want to learn more about. As you've seen, we've tried to not to be too specific. But yeah, if there is a specific use case or questions about how to use the system in a specific use case or type of condition or else, don't hesitate. Now is the time to interact, ask as many questions as you need to. Hang on a little bit till until the end, so we'll share as well some info to get some offer or discount if you don't have the kit yet. So yeah. Yes, Ken,
Yeah.
to answer your question, yes, the webinar is recorded. You will receive, once it's stopped, you will receive by email the link to the full recording. So
Cayman. So we do have some use cases. Um, and then I can even just sort of address that. So one of the things that we see when we see in fatigue, a 5 kilometer run, you may not see as much, but maybe in a 10 kilometer run. Um, what the other thing that I do and why I sometimes use a treadmill is we can overstress. So what I can do is I can actually have someone run at a faster pace, or you can have them do squats or some type of activity, or just have them run on a treadmill for the first whatever distance, and then set it up and then have them run again, and then that way you can get some comparison. So a couple things that we tend to see. And please excuse me, I didn't put it in, but you can also, and that's the advantage of also using a treadmill, is we also have video option, and so you can run it at the same time. The video it's qualitative, but we do give you the option, so you can download it. I can put it in one of my video analysis and look at that as well. And so a couple of things you'll see is interesting is you'll see changes in velocity, but sometimes they're maintaining velocity. And one of the things that you can pick up, especially during a fatigue moment, is you'll see if they're maintaining normal velocity, you'll see an increase in cadence and a decrease in stride length. And you can also look at ground contact time or the relative percentages. And then what I also do is I'll look at from foot in, but especially from transition into propulsion, how much time they spend there. What will happen is they're not as good at propulsing, and so that's a typically what you will see in a reduced stride length as a result of fatigue, right? So if there's a reduced stride length, you will also see potentially a difference in the strike pattern. So it may be further reduced. And what you'll especially see is, if someone is normally a heel foot striker into more of a midfoot, or if they're a midfoot striker, you may see more of a forefoot striker. So definitely looking for some of those changes as well. The other thing that you may also see in fatigue is looking at foot orientation during that ground contact, and you will see an increase in the variability. And then lastly, another
get
thing that you will tend to
their
see is
discounted
you'll
quote.
see an increase in
Ah
strike
ouais,
force.
to get this the
I hope that gives you some information.
prends la question du gars là.
Sorry, I believe. Yes, and we realize that people have to move
So
about and get on with their day. So yes, just to reiterate again, there is going to be a recording, and actually, I think Rana probably already
so
posted some.
Chris, I see that Ramsey sent us a question. So so
I was
Chris, you
waiting,
mentioned,
Ramsey.
yeah, we were waiting for you. So Chris, you mentioned that we are measuring the foot as a solid block in the analysis, but as it has 28 bones and 33 joints and 100 ligaments, how far away are we from becoming more specific and breaking things down to individual sections of the foot, rear foot, midfoot, forefoot? So it's a great question actually that we get sometimes, but
Yeah.
yeah. So yeah, let's share your approach and your thoughts
Yeah,
on that.
and then Giannis, feel free to step in as well. So that was Ramsey. That was a big question I had. When I first started working with the organization, really how we were measuring that. And so the short answer is that can we get more specific? I'm not sure you can do that. I mean, if you're using a Vicon mocap system with bone pins, that's probably as close as you're going to get, but I don't think we're going to stick a bone pin in every single one of those 28 bones, maybe, but probably not. And so just I'm making an excuse first, which is we're never going to have that totally, but what we do know, and how we can explain it more so, is I look at this as, how are you responding in your, I look at shoes as corrective devices. And I know you've been in these because I've given presentations on the influence of shoes on walking pattern, in that, you know, you can use it, you can cast someone with an orthotic, and it's going to be different in every shoe, and especially if you cast them based on a static position, and especially if they're barefoot, right? And so I think you're touching on something absolutely that makes it challenging. Where I think we lead to that is the history, their performance in some of these other things like range of motion, palpation, and for example, in that last series I showed you, you know, his calcaneal syndrome is consistent with, what we saw in that foot. And it's interesting because we see that in all of the footwear that he wears. And so but it's also different whether he's walking or running. Now, that same person, I should have shown you a walking analysis, because in the walking analysis, he's able to actually transfer over to that first and second ray when he's toeing off. So the problem might be is if I were to cast an orthotic for him based on his statics, he really should have a different postings, whether he needs it for walking or running. So I don't know. Maybe that's a long drawn out excuse for, yeah, it doesn't change, or it doesn't take away from, some of the other things that we need to do, which is, getting a little bit deeper. I don't know if you had
All
anything
right.
to add to that, Giannis.
No, I think overall, as I think what you mentioned, especially about that, looking at the shoe also as a, as a kind of corrected device. Um, I think it's the answer lies a bit there as well. Is that it's true. The foot is a much more complex system than the way it's being approached in some ways. Um, I think
Right.
also the way you presented it was also just to represent what we are to kind of um, simplify what we are measuring. But in fact, when you look at it in detail, since we can measure different positions and movements at different moments of how the foot touches the ground, then it gives a direction on how the rear foot, the midfoot, also on the forefoot moves. And as you mentioned, I mean, the fact that the foot is in the shoe makes it also less mobile
Right.
than the complexity of how it is. But yeah.
Yep.
So I don't know if there are other questions, or I see that someone is typing in the chat. So no problem, we have time. Again, feel free to ask any question. Now is the time. It's much easier to interact right now, especially that we have Dr. Chris with us here. So it will be much easier to answer. And yeah, don't hesitate to look at the messages that we've sent to get some more info about the kit and the codes. And also, if you have any questions, you can also reach to either Chris or Aisha here, who sent her email address. So yeah.
Oh, she did. Yes. Yes, that's mine as well. But yeah, Cayman, I'm happy to have more discussion for sure.
Yeah. Also, the good thing with the system is the more you use it, the more you try it on different, patients' use cases, the more new things also you observe and you learn. I don't know about you, Chris, but I feel like, I mean, even me on my side, the more I've been using it, I've been discussing with clinicians and practitioners. I felt like the more we could discover how to use it in different sets, in different setups, you know. And that I think that's also kind of the beauty of it, is that the more you use it, the more you discover things, and the more also you learn how to use it in specific setups.
Yeah, I agree. And the other, the other thing is when, even when I'm working with engineering, is to remind them that, I have that person in front of me, so I'm going to get even more information if they have pain, if they've done some things that seem to work or don't work. I may test them, for neurological problems as well, their history. So there's other things that we don't want to forget that are still part of that. Still part of that. So even if we're just looking at gait, that's why I always do a walking test, because it's already in their feet. You're going to get some normative data from that, and that may give you some more implications to some of the things that might be going on, or just simply the difference between walking and running, and why we may need to do something a little bit different. And in fact, a lot of people can walk, and you may not identify some of their potential issues. But that's also why you know I I grew up in the academic world looking at force time curve characteristics of uh, of pulls and statics, and even power characteristics of vertical jumping, and how with our system as well. The jumping tests, I think, especially if I'm working with runners, I always have them do jump tests, because it gives me a better sense of what their strength, power, and reactive strength index might look at.
Yeah. So I see that Ramsey wanted to add on what on his question and the answer that you gave him. So the initial movement after heel strike might be subtalar joint, but a second pronation metatarsal joint will not be measured. I may see mild pronation visually with walking, but digital reports back small data pronation number because it only measures initial contact data. Yes. I'm trying to make sure that I understand properly the point. Sorry, yeah, it's not easy.
Yeah,
It's always
no.
easier when it says when if you explain it talking than reading. But I get you. Did you get the point, Chris?
So yeah, so what it is, yes, in a sense, Ramsey. So we're getting the 1 point on contact, and then we're going to get foot flat position, right? And so then it's just creating that trajectory between those 2 points. I mean, their means, their averages of however many strikes we have, however many foot flats, and however many transitions and propulsions. Um, and so it's not giving us that continuous pathway. So it may not look as linear exactly as we are representing. Maybe it's a little bit curvilinear in terms of getting from that first initial contact point to the next contact point. I think that's what you're asking. So yes, it's making a certain assumption from that. But again, we're looking at the performance outcome aspect of what the foot is doing relative to the surface of the ground, and not completely, absolutely what the relative orientations of the structural aspect of the foot itself. But again, some of that, depending on what exactly we're looking for, is predictive in nature of the
Hmm.
aspect that we're
But
looking at.
in the meantime, I would be also interested, Ramza, at some point. We could discuss more in detail to see exactly because I think I mean many times we've been able to observe visually the pronation and see it also in the data, especially when you look at, because as you mentioned, Chris, yes, we measure at initial contact, and then at, if we talk about walking, at initial contact, then at midfoot in, then heel off and toes off, and most, I mean, every time we see visually that the foot let's say pronate in a way, if we can say if we can still say pronate,
Yeah,
because the
yeah.
word is still a debate. But anyways, we can really see it in the data. So
Well, also,
I would be interested to dig deeper into that as well with you, Ramsa, at some point.
yeah, and also related to that, Ramsey, is kind of, with like the orthotics where we can input, certain things, and maybe that's something here, sort of, Giannis, like what I did with um, improving predictive models of gait patterns or sensitivity of a neurological condition, for example. If we add other, patient demographics or things like that, maybe there's an opportunity here if we want to, you know what's a measurement for, an FPI 6. Are they pes planus or cavus? And whether or not we can input that and how that may help to translate some of the data, or as with the scanning that we're doing with the orthotics, might be something of interest. I don't know. And then lastly is, potentially having them walk on something barefoot as well. And as I've kind of thought about, is maybe beefing up the motion capture aspect of this. Obviously it's not as sensitive, but maybe we can get some data points to
Hmm.
aggregate and develop something different. I don't know, but just a thought.
Yeah. Kamen had a question as well. So, in terms of high running dynamics, any discussion on left and right side data synchronization, especially when comparing the functional performance parameters? Any idea about the necessary timing accuracy? I'm not sure if the question is oriented towards the precision, the accuracy of the system by itself, or something else. But basically, the way the system works is pretty. I will maybe kind of pre-shot the potential answer here. Basically, the system works very the both modules that are in left and right are synchronized together. So the timestamps, so meaning each sample of data recorded, are synchronized and set together. So basically, when we collect the data, pod left and pod right are all synchronized on the same clock. So when there is an event, let's say the contact of the foot when the foot touches the ground, they're synchronized at the same timestamp.
Hmm.
So at the same event. So basically, right now the way it works is like fully synchronized between left and right foot in terms of timing. Um, so yeah. Yeah, and Christoph, to answer your question, yes, you can buy the device in Poland. Reach out to us, and we'll get in touch with you for that. I see there is
Uh,
another question, Ramsey.
yeah. So he
Uh,
he picked up on a comment I sometimes make. So I'll give you my opinion, which is, and it dates back decades in terms of what's referred to as the complex motor theory, which is that having some degree of variability indicates that we have the capacity to change to a changing environment. And so what I mean by
so
that is, if you took a cross country runner who runs on a trail that's uneven versus a person who runs on a treadmill consistently, they're going to have a larger variability. We were working with para Olympians, and what we saw was very interesting. So, in other words, when they trained very, very hard to overcome their disability, their variability would shrink down to near zero. We also see this in patients that have typically more acute, and acute versus chronic. This is actually even another direction or story, but it helps to sort of outline the fact that variability can change even in the same pattern. So there's not necessarily a ton of information, and in fact, it also relates back to more of a global scale. You know, when we look at variability, so for example, in the Romberg's quotient. So the Romberg's quotient is derived from the Romberg's test, right? Which is eyes open, eyes closed. It's the relative deviation from center position, but how quickly we get back to it, right? And so what we tend to see is that there is constantly a deviation, but the ability to get back to that. And so we added that to, I don't know, Ramsey, if you have the rehab module with the jumping tests, but that's something that we've been working with, and that's referred to as contact stability. And so we did, in my previous life, we did an interesting study looking at reaction times and the amount of variability, especially in relative ankle orientation and the ability to correct, especially as it goes beyond a certain point. So it's probably a bigger discussion, and maybe it's not as evident or outlined, but there's some, and I've just found it specifically in clinical practice as well, and how I tend to operate.
All right. Thank you, Chris, for that answer. Um, Again, I think we're already past 7 minutes on the original timeline. Thank you very much all for attending. Thank you, Chris, for making things short. It's always appreciated, and
I
take this
know.
time for questions. No, it was great. Obviously, as I said, don't hesitate to reach out to us. The door is always open. We are always we try to be as reactive as possible to any question, any point. Um, so thank you very much. If you want to have a specific call to discuss some specific point or question, don't hesitate. Reach out to Chris. Reach out to Aisha, and we'll do our best to answer you. And don't forget to send us an email for that discounted quote for the webinar. So thank you very much all. I wish you a very good evening if you are on the European time zone. Good rest of the day on the US, and whatever timeline you are. Have a good rest of the day and week,
Exactly.
and talk to you very, very soon. Thank you all for your
Yes. Awesome.
participation. Very appreciated. Thank
Thank
you. Have a good day.
you. All right. Take care.
Bye.